But what I'm going to talk about is new difficult airway devices, but really I'd like you to focus more on the idea of these being airway devices, not difficult airway devices, because really they are devices that we use for every airway. So I'll start with a haiku. Can't intubate, can't ventilate. Panic, flail, brain cells die in bunches. This is our worst fear. You have a patient who comes in, they're alive. They're talking to you, maybe they're swearing at you. They're doing what they do. You have to manage their airway. You do some stuff. They stop breathing, or maybe they stopped breathing on their own and then you did some stuff and you can't make it work. You can't get the tube in. You can't ventilate them. You can't oxygenate them. Sats are falling. Bad things are happening. And you know that the clock is ticking. It's one of the most, I think it is the most uncomfortable feeling we have in emergency medicine, right? If you think about it, if somebody comes in cardiac arrest, they're either going to stay the same or get better. You can't make them worse. But when somebody, I mean, you could fail to make them better when you should have, but even that's not so bad because they were dead. But when somebody comes in and you have to manage their airway and you can manage it and they go on to a completely normal, productive life, or you can fail to manage it and you have a catastrophe, that's a high-stakes game. And it's a high-stakes game that we play almost every day, or in some cases every week or every month, depending on your practice, but really it's an everyday occurrence. So at the core of this practice that we have, which is helping people who are worried feel better and helping worried parents feel better and taking care of people with minor things and getting them back on their feet and taking care of people with major things and really improving their outcome and taking care of people with catastrophic things where our training really makes a difference. And then at the very edge of that are these patients that 5 minutes makes a total difference between whether they go back to their role in society or become dependent on society or are dead. So it's a big deal for us. And I can tell you, I've been doing this for 30 years, I guess now.